Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me is Dr. Amy Parekh, Chief Medical Officer of Grand Rounds, to discuss the risks of postponing wellness visits as a result of COVID-19. Dr. Parekh, it's great to meet with you. Welcome to Trade Talks.
Thank you so much for having me, Jill.
And besides the economic hit that so many Americans took due to the pandemic, I'm concerned about the impact passing on health and wellness visits, what that's going to have to their health and also to the healthcare system. As you are aware of, early detection is so key to our healthcare. So with non-urgent medical procedures and wellness visits having been postponed during the pandemic, what are the long-term health risks?
Yeah, such a great question, Jill, and one that many in the medical community have been concerned about over the last 9 months. You know, we saw a dramatic drop in vaccinations, cancer screenings in sort of the spring timeframe. We saw mammograms drop by over 70%, colonoscopies by over 80%. We also saw people lose access to their chronic medications. So people, because they couldn't get into their primary care doctor, weren't able to access their diabetes medications or their hypertension medications. What this sets up is a high risk for 2021, right? Where we could worry that we're going to see patients come in with later stage cancer diagnoses than they otherwise would have, which is both obviously worse for the patient, but also worse for our healthcare system where the costs are continuing to rise. Also for patients who are unable to get their medications, like for hypertension or diabetes, it puts them at risk for things that are much more concerning, like heart attacks or strokes. But I do think we still have an opportunity, Jill, to correct this before it gets even worse. So I'm hopeful that with the advent of more virtual care that can help patients manage their chronic illnesses despite not being able to access medicines, we will be able to help patients not have the really dire consequences of missing out on some of that preventive work.
Behavioral health and physical health conditions are often comorbid and costly. What impact does this have on the healthcare industry?
Yeah, another great question, and one that many of our employer customers have been asking us about. We know 68% of people who have a behavioral health condition also have a medical condition. And unfortunately, people who suffer from both of those conditions simultaneously cost about twice as much as a person with only one of those illnesses. It's just hard to manage your diabetes if you're also depressed, or your hypertension if you're also anxious. And so what this means for leaders in healthcare, companies like ours and others, we will have to create models that take care of both the behavioral aspects of care as well as the physical aspects of truly integrated care is what's going to help us help our patients get better over the long term and help our economy get better, because what we really want is for the total cost of healthcare to come down. So I think providing truly integrated care will be how we're going to have to address our patients' needs as well as our customers' needs.
How can the healthcare industry create a better overall experience when it comes to primary care?
Yeah, great question. I think the first step is us all acknowledging that primary care is important and that we want people to engage in primary care. We know that countries where there's high levels of engagement with primary care, they spend less of their GDP on healthcare needs. We also know that patients who engage in primary care stay healthier for longer. And I think once we all agree that primary care is important, we will create new friction-free ways to access primary care. You should be able to access your primary care the way you want to, when you want to, whether it's on your phone, through your computer, whatever channel works for you, because we want to make it easy for you to get primary care. What will be important is that as we do virtual first primary care, how do we make sure that when you need physical health care, we can guide you through navigation to the best quality in-person care possible. So these integrated models that are virtual first, but really can help navigate through the physical ecosystem as well as healthcare will really be how we transform primary care into the future.
Tell me more about how Grand Rounds is advising employers and members to return to care and keep the country and economy healthy.
Yeah, thank you for that question. So at Grand Rounds, we serve a diverse set of employers, everywhere from companies that are keeping our economy running with their essential workforce to companies that provide digital and tech services to so much of our country. And that has allowed us as Grand Rounds to provide advice to our customers. Things like, when was the right time to send people to working from home back in the spring? And now to questions like, as the vaccine will become more and more available, how do we return back to work in a safe way that keeps our employees comfortable and safe? We've sort of offered a virtual chief medical officer type role for many of our top customers. And some of our customers like Crown Castle have said, without Ground Rounds as a strategic partner, we really wouldn't have been able to handle this pandemic as well as we have. For our members, the pandemic has been one of these things where it's been incredibly equalizing. Every single one of our lives has been affected by the pandemic, but the importance of personal advice has also become critical. For some of our members, it's things like, how do I get to work safely? I'm an essential worker. I need to go to work to help the economy run while we're in a pandemic. But are there better ways for me to get to work safely? How do I keep my family safe as I continue to work? And we've been helping members with those kinds of questions. And for others, they've been working from home and they're trying to manage the mental health implications of having their children schooling from home, their partner in their home as well, and all of the mental health strains that has brought. And what's been nice is we've been able to help that diverse array of members through this time.
Dr. Parekh, thanks for joining us on Trade Talks, and thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.